All right. Good morning, everyone. Welcome to this webinar. We're very happy to have you all here. And today we have two very special guests who will share with us some of the lessons learned on measuring child and youth system change around the globe. These fellows of mine are they are super pro in what they do in terms of youth system strengthening. And today I want to
Okay, Mike froze, so I'm going to take over for right now until he comes back. My name's Bonnie Politz. We can go on to the next slide. So my name is Bonnie Politz. I am, I say, the co-champion of the Youth System Strengthening Community of Practice. I do this in partnership with Mike Hernandez. I'm in the United States in Washington, D.C., and Mike is in El Salvador. And we welcome you to this event. So we'll go into the next slide.
Okay, so in today's agenda, we have the overview of the YSS-CoP and the Youth System Collaborative Framework. We have also the presentation of our guests, Audrey and Laura Meyer, Audrey Moore and Laura Meyer from Mathematica. We will have a discussion time and the coming up events slide. So I hope you enjoy this webinar, you enjoy these presentations and learnings from our fellows from Mathematica. Next slide, please. And remember to join the CoP, Youth System Strengthening. You can join us at youthpower.org. You just click on the register button, and then you click on connect, and you will find our CoPs, as well as the other CoPs that work around the globe. Next slide, please. Bonnie, over to you.
Thank you. So as part of the Youth System Strengthening Community of Practice, we have been using a framework that was created by the Youth Systems Collaborative. And the Youth System Strengthening Community of Practice is this really, we hope it is, this open learning space that's allowing all of us to learn more about what's going on, about how we are building approaches to system strengthening, what we're learning from it, the processes, the outcomes, anything that will help folks who are really focusing at the systems level to learn more about what it's taking to get positive outcomes for young people. And this framework, over the course of the past few years, we've been using this to have people tell their stories about what they're doing from a specific aspect around policy or actually implementing changes in norms and mindsets for decision makers, or how budgets are being developed in different ways. And today we're going to be really focusing on the data learning and evaluation, which is part of the core, one of the core aspects of really changing systems. So we can go on to the next page. And the members of the Youth Systems Collaborative, which is, we're really sort of an international learning network. And we come together once a month to share what's being learned. These are the organizations that have been a part of this. We have a learning agenda. We have written an article. And so there's, in the next year, we hope there's going to be a lot more work to uplift what we're learning about what it's taking to impact change at the systems level for young people. So we can go on to the next slide. So I'm very excited, as Mike said, to introduce our speakers. I've known Audrey Moore for many, many years. We worked together at the Academy for Educational Development, which is now FHI 360. But she was always an incredible ally as we were building sort of a real research and evidence base about positive youth development. She got it early and was always very excited about ways to be able to utilize it. So I'm excited to see her again. And then Laura Meyer, who's also a researcher at Mathematica. And then maybe they'll say a little bit about Mathematica, and then we're going to get into their presentation. And please remember to put any questions as the presentation is going on in the chat. We'll come together before, we may not go into breakout groups because it's ended up being a smaller group today, but that'll give us more time to really learn about the implications of what they've been doing, for young people around the globe. So I'll hand it over to the two of you.
Great. Thank you, Bonnie, and welcome everybody. We're really excited to be here today to share some of the systems work that we've been doing. As Bonnie said, Laura and I work at Mathematica. Mathematica is an independent company that serves as a third-party evaluator for a lot of the donor and foundation communities. We are started primarily as a domestic organization and have expanded into international over the last decade and have a growing international unit that does impact evaluations, performance evaluations, and other strategy and MEL work for our foundation clients. And Mathematica has been in existence now for about 50 years. So we're very excited. A lot of our foundations are very much into the systems change work around the globe right now. And Laura and I are excited to have the opportunity to share the work that we've been doing with the Hilton Foundation in Kenya, Tanzania, and Mozambique. And so I will turn it over to Laura.
Thank you. I think we can go on to the next slide. These are some of our research partners. So we do want to give total credit to we research organizational partner in each of the 3 countries that we're working in. In Kenya, we have the ECD Network for Kenya. In Tanzania, we're working with the Ifakara Health Institute. And in Mozambique, we have Kishikwila Consultoria. And so each of them, like it's been a group effort, like working hand in hand from the beginning. So I would be remiss if I didn't give credit to them, even though they couldn't be here. Next slide. So our systems work here is taking kind of a multi-stage process. And so one of the first steps that sort of has been done iteratively now throughout our engagement in this project is we've been going through the progressive process of systems mapping. So it's been facilitated by us loosely, but then driven by our country research partners. So for example, initially we went over the task, like we want to make a map, and then we worked with them, or they went away and they produced a comprehensive list of system actors. And then we worked together to map them. In a couple of countries, this is actually done interactively via mural. So we sort of had a facilitated session where we were throwing different actors up and like, how do they relate to each other? How does, the authority relationships work? And and I think this was especially an important step to take, given the multi-sectoral nature of early childhood development. And one thing is, I did want to take a step back, and by early childhood development, a lot of times people hear that and they think like preschool, pre-primary, et cetera. And our focus here is primarily on children aged 0 to 3, so very early child development. And so that especially is a sector and a system where the structures don't fit cleanly on the organizational chart of any one sector, which I believe is also true of youth programming. So after they produced the list, then we went ahead and mapped them together. So we can go on to the next slide to see an example of that. So this is a really cool and really great one of the resulting maps, and this is for the country of Tanzania. So it's organized so there's a different sector primarily in every quadrant. We have, other government in the top left, education top right, bottom left is health, and then the bottom right is sort of the NGO and donor community. So one thing is that we tried to flip the focus a little bit from the top-down approach typical of government organizational charts. We tried to put the child and their caregivers at the center of it all. So it flows out to direct service providers, to the local and regional government authorities, to the national level authorities who are actually at the periphery here. And while these national level authorities are so important for setting the agenda, we also think that it's important to kind of also look more closely, because sometimes these sort of top-down approaches obscure the more complicated systems dynamic at the point of delivery. And I think this was an important step, and this approach kind of highlighted some, gaps and things just by sort of arranging it in this manner. And it looks really cool. So yeah. Next slide, please. So the next sort of big stage is moving on from the sort of systems mapping which primarily focus on sort of the on-paper relationships between the different actors. We then did a systems diagnostic process. We built on the RISE research on improving systems of education systems diagnostic that was recently launched in the last couple of years. And we made a series of changes to it. So some of the changes were somewhat find and replace, kind of superficial in terms of, swapping out one ministry, swapping out the names of different frontline workers. Then there were some more substantive changes and adaptations that we made. We were sort of de-emphasizing factors that aren't relevant to younger children or have no counterpart in ECD. For example, in education systems, students can often engage in advocacy efforts, forming student unions and so on. But 0 to 3-year-olds, while they have very important needs and they often make them very well known, they aren't quite up to forming unions or the like. So we took out some of those pieces. Then we added in concepts that were either unique to ECD systems or more closely tied to the learning needs of the Hilton Foundation. But like RISE, we break the system down into a series of accountability relationships amongst state authorities, caregivers who are also citizens and thus usually voters, implementing authorities like the Ministry of Health, and frontline workers in the healthcare sector. And that includes both facility-based, nurses, doctors, as well as community health workers who are often one of the primary touch points between families and a healthcare system. So once we've gone through that process, that left us with a series of questions probing on these relationships. So the questions cover things like what an actor wants, what are the financial and non-financial support that they provide, what is the information they use to assess performance, and the ways that they're intrinsically and extrinsically motivated to fulfill those roles. And so the way that we approach this is these relationships then can be broken down and considered in terms of like what ultimately are the priorities of these different relationships and their dynamics. Next slide, please. Thanks. So here we have rows. At the top is the original sort of framework from RISE, and at the bottom is the one that we ended up including in our diagnostic. And so you sort of see this is a specific example. So in the left colored column, like in the education system, they focus on education management information systems. Since we're focusing on the healthcare, that becomes a pretty simple switch to HMIS or health management information systems. And then the first sort of column with text on the left. So the RISE sort of ideal scenario is that a system and the different pieces of the system are going to be coherent for learning. So in a system that would be coherent for learning, the most critical information in the information systems will monitor both, inputs like, desks and whatnot, but they also will monitor, learning outcomes and, and similarly, our parallel to that would be a system that is coherent for nurturing care. And so with regards to an HMIS system, that means that they have a high quality, up-to-date HMIS system that tracks inputs and outputs, supplies of vaccinations, but then it also tracks, care provided by families, facilities, and early childhood outcomes. And then again, in an ideal scenario, HMIS data, access and decisions forms the basis of decision making at the subnational, local, and national levels, and that they have authority at these different levels to sort of make changes and adapt on the ground to the what's showing up in this data. That's the ideal scenario. And then there's other different ones in moving more quickly. So Align for Access is one that has parallel across both. So, typically, you're in an education system that's aligned for access, you're measuring, enrollment and attainment, very simple, they call thin inputs. And similarly, in HMIS, it'll focus on, the quantity of inputs of services provided. And then, the data goes to the top and they, try to allocate and try to maximize access, which is necessary but not sufficient for, optimal outcomes in both systems. Similarly, they both might be aligned for process compliance, where it's more about like, are they aligning with the rules? Are they aligning with the policies? Again, possibly necessary, but definitely not sufficient. So, and then you can see also that there's some like aligned for selection, which doesn't really have a counterpart in ECD, so we dropped that. There's some that are aligned for, like, in some systems, they could be aligned for patronage or like, trying to, reward followers, etc. Again, we didn't really see a parallel there, so we dropped it and kept it narrowly focused on sort of the three outcomes that you see, or the three sort of alignments and scenarios that you see in the bottom row. Next slide, please. So putting it all together, here is a sample question from our diagnostic. And this is actually one that we didn't find in the RISE one, in the RISE diagnostic, but because it focuses on equity, we consider it both important and in general, and to the foundation, and it wasn't covered by the existing tool that we were adapting. So equity. How does the system assess equity and provision of nurturing care services? A big question, no? So, the big question is almost too big. So what you end up needing to do, and again, this came from RISE, is then there are more specific, what we call guiding questions that go with that. So more specific questions that help us get at that big question is, does the system track any metrics related to equity in the health and other relevant sectors? And how and to what extent are these metrics incorporated into decisions about resource allocation? So, and then sort of to help probe discussion and probe thought, we have our two scenarios like the ones I was just talking about. So in a system that would be coherent for nurturing care, equity and quality of care and child development outcomes is monitored, in addition to access along several dimensions, including gender, rural, urban, socioeconomic status, children with disabilities, children with young mothers. So that would be our ideal scenario. Then on the right, we have, again, the more narrow approach to assessing equity, where it's assessed narrowly in terms of access. Distance to the nearest health facility in rural areas is a metric that you commonly see. And this measure doesn't really consider whether the facility is open, whether the facility has staff, whether the road is in such a bad condition that it's basically inaccessible. Distance to a facility is not nothing, but it's not really enough to assess equity in terms of access to key services. And similarly, this would be measured in the education. This might be measured in terms of enrollment rates. So next slide, please. So then how do you answer this question? Well, we didn't do any of the answering. Instead, I wanted to highlight one of the responses from one of our three countries. This is Tanzania again. They conducted sort of a co-creation collaborative session with stakeholders in the ECD space, government, non-government. And so the reason why I wanted to highlight this one is that it really impressed us in the thoughtfulness and demonstrated the extent to which our country partners took this tool and they really owned it and used it for themselves to understand their system, including the gaps. And then ultimately they used this to select indicators for the resulting measurement framework. And again, this really just blew us away in terms of the thoughtfulness here. So they reference the ECD multi-sectoral program. That's a big deal in the ECD space in Tanzania and East Africa more broadly. They talk about, what's in there. And this is a huge step forward, but there are still gaps in terms of children with disabilities, young children, developmental delays, et cetera. So they're saying, strengths and weaknesses, challenges and opportunities. Resource allocation, they noted that the allocation of funds typically excludes children in prison, children whose parents are in prison, homeless, and orphans. And then the last piece that I didn't talk about earlier, what we did is for each question, there's a section for outstanding questions and missing information. So here they really pulled out the fact that, there's an outstanding there's a gap here, and that there's just not an availability of simple and user-friendly tools to measure children with developmental delays. So again, this sort of simple but broad question sort of brought out all of this rich nuance about the system. And since that time, they've taken and they've developed monitoring frameworks. And one of those is they're trying to assess both qualitatively and quantitatively, progress and towards filling gaps like these. So really cool. Next slide, please. So that all got us to, so each of the countries completed these diagnostic sections, as ended up being a tool of about 28 questions. And what we did is we took these free responses to the diagnostic prompts and we conducted a cross-country analysis to identify common themes across countries as well as differences. So this depicts the 3 countries by the 4 dimensions that are the focus of the Hilton Foundation: policy, governance, multi-sectoral coordination, and financing. And then sort of a rough categorization around the main themes that emerge from the diagnostic process. So green for present, gold for partially present, and red for not present. One thing we did struggle with in the process of putting this together is that there is a lot of overlap between the dimensions, and in practice, these dimensions are kind of more of a Venn diagram. So as you'll see, the 2 dimensions that have the most red and yellow are multi-sectoral coordination and financing. Policy and governments look a little bit better, in large part because they've done the work on paper in terms of having policy frameworks and government structures in place, but implementation remains a significant challenge. But multi-sectoral coordination and financing, I think, maybe are more in their nascent stages. All right, next slide, please. So questions?
Yes, so we hope that people, since it's a smaller group, if you have a question and you want to just raise your hand in the bottom, that's great. Or if you'd like to put a question in the chat. I'll start off with going back to the previous, the last slide. And I think I put in there, what happened to this summary of findings? Who did it go to? Is it being used? How is it being used? I mean, it's great to have this, and this is definitely focused on almost all aspects of the systems change, framework we have from the YSC. But what's happening with this? And then I think we're going to get into a discussion about the implications of this for youth.
Mm-hmm. Yeah, I can speak a little bit to that, Bonnie. So just as a little bit of background, the adaptation to the RISE framework that we did was for the purpose of doing a systems diagnostic for each of these countries. So the purpose was to sort of get a baseline of where these different components of the system were once we had done that systems mapping. So this kind of scorecard tells us the status of the system in each country and where they're different and where they're similar. And so from here, we brought together, each country had their own individual systems diagnostic report, and we synthesized that information into a synthesis report, and that was presented to the Hilton Foundation. And it served as the basis for the local teams to develop systems measures. So they took the information from each of these categories and they developed a series of indicators that they felt were best positioned to help them measure change in the ECD system over time. And we supported them in developing some of those indicators. We made sure that each of the 3 countries had at least a few similar indicators so that we could look at change across the countries, as well as parts of the system that were specific to each of the issues that different countries were facing. Our teams are now collecting that data. They're right in the middle of getting the data for their indicator framework. And it includes document review, because a lot of the data is part of the HMIS system or part of the paperwork that's kept at health centers. It involves a lot of qualitative interviewing and meetings with high-level stakeholders. So we'll be getting all of that information by the end of July, and the teams will start to put together their indicator framework reports, and that will go to Hilton, and that will give them a sense of where each of these ECD systems are. And then in the next phase of the work, there's going to be an advocacy piece that's going to be added. And in addition to our team that's doing kind of this evaluation systems work, Hilton funds grantees in each of these countries that are working with specific pieces of the system related to ECD. And so the purpose is to kind of work on the ground to shift some of these systems. And then we'll be continuing to gather data over time to see if we can see shifts in any of these measures across the different categories. And so we'll continue to use the RISE framework once every couple of years, and we'll do the indicator collection on an annual basis. I don't know, Laura, if you would add anything?
No, I think that's great.
And Bahati, I see your question about coordinated relationship between the countries around best practices. So yeah, what's been really fun and very interesting is as each of the countries finished their systems diagnostic, they actually did presentations to each other. So we had a series of webinars where each country team would present their findings, and they would have an opportunity to talk to the teams in the other countries and share information and talk about what was working and what wasn't. And then once we collect all of the indicator data, there'll be a series of sense-making or learning events where the results will be shared not only in country with stakeholders, but across the 3 countries as well. And Mike, I saw you had your hand up.
I was going to ask Bahati's question.
Yeah.
Okay.
So I had a follow-up to this also, and hopefully people continue to put your questions in the chat or raise your hand. But what's the link between what Hilton is learning and uplifting this to the public sector that has such a responsibility to make some of these systemic changes? I mean, they're involved along the way, but how is the public sector involved in this in terms of decision makers, even, at the legislative level as well as ministry levels?
Do you want to take that one, Laura? Go ahead.
Sure. So, I mean, each of the countries and each of the research teams, they have like an advisory board. So that the advisory board has been with them every step of the way. And in fact, a lot of the time, their advisors are also like key decision makers in the sector. And so I think one of sort of I wouldn't say it's an unintended consequence, but one of the nice sort of outcomes of this is that by doing the diagnostic with these different public sector decision makers and stakeholders, we're also kind of having the effect of like building systems thinking into the public sector and having them think about, by asking them these big questions, having them come up with answers. I think there's also sort of some advocacy in the process of research as advocacy happening. In addition, they're presenting results to them. So it is a lot of the focus, some of the focus is cross country, but a lot of it is because it's kind of widely understood, like where they want to get and like whatever the challenges are, the sort of the levers and the avenues are all a little bit different. And so a lot of it is just sort of building relationships with the stakeholders, both in doing the work and in disseminating and trying to raise awareness. One thing that's been kind of fun is, like I mentioned, Tanzania. I keep talking about Tanzania. It's sort of a nice way to simplify, but it's also one of our success stories, is when they went to them and say, we need to come up with a systems measurement framework at the same time that this national multi-sectoral ECD plan was being launched. And basically the government stakeholders now were like, great, you can sort of help to do the systems level monitoring for this plan, because they had started it, but they had never fully fleshed it out. So simply by having these conversations, they've just been sort of been coming along the way with us. Mm-hmm. This is really exciting.
Yeah, and I also think in Tanzania and Mozambique, they've got these multi-sector collaboration working groups. And so both of our local partners are somewhat embedded in that working group, and that helps make the connection between what we're finding here and the policymakers that are working across the system. And it's interesting, and I know the systems map is quite complicated and hard to kind of take in a webinar, but there are 3 or 4 different sectors that are engaged in ECD. So you've got education because of the pre-primary, you've got health with the 0 to 1,000 and nurturing care and, mother's health. You've got agriculture where a lot of the nutrition work and food security sits. And then there's often a social welfare unit of the government as well. And that's where a lot of the social supports, inclusion, gender work sits. And all of them, you can see from the results of the financing, they're very stovepiped in their funding. And so I think a lot of this work has started to get these folks communicating across those different silos.
That's really critical. Thank you.
Yeah.
For that. That's really important.
Yeah.
Yeah, I mean, we always say we have to sort of reframe all of the work that we're doing to really impact what changes for young people, children, young people and their families. The systems have to reframe how they interact with each other because we're dealing with whole people, whole children, not individual pieces. And that's the way systems have been set up. So,
yep. And at the very center, if you go back to the systems map, you can see that we started with the whole child in the middle.
right.
I don't know if you can actually see it so you can see here, the whole child is in the middle and then the community around it. And then we went out from there instead of starting out and working in. So when we were working with each of the teams to build these systems map, we started with that small circle in the middle of the mural board and then worked our way out, because I think that's exactly right. And one of the reasons that I think we wanted to share, this adaptation of the RISE framework for the systems diagnostic is because it is very similar to the youth sector in that you're bringing together a lot of different sectors that need to support the whole youth person. So a lot of the adaptation and thinking that we did for ECD, I think applies for the youth sector as well.
Audrey, do you want to move on to, some of that related work? And that's further down, I think, after, yeah.
So go ahead, Laura.
Sure. So first of all, I'd ask you to sort of think of a system that you're familiar with. Maybe you don't, one that you sort of know, but you don't necessarily know like fully well. And so we're going to go through a couple of different activities to sort of try to kind of replicate this process or do some of these exercises that we've been doing over the last, over a year now at this point. So a lot of the adaptation needs to happen so typically across most systems, this sort of simple version that comes from RISE is a lot of the stuff at the box at the top remains mostly the same. Like in every state and every system, there is a relevant, state authority, legislative authority, financial authority. But then a lot of the adaptation that needs to happen is at the bottom right. So think about who are the frontline providers who are most important? Who's the primary implementing authority? And what is their role? And then in sort of the bottom left quadrant, so ours is a little bit different because, as I mentioned earlier, children 0 to 3 are not yet in a position to advocate for themselves towards the government in quite the same way. But I think that in the youth sector, it might look a little bit more like the education system, possibly with additional dynamics, perhaps intergenerational dynamics might play a factor. And so I don't know if you wanted to sort of think through and throw out any ideas as to how, this might look different if you're focusing on the youth sector.
So maybe just starting with that question. So in the youth sector, based on the work that all of you are doing in the field, who would be your frontline providers? Who are the big categories of service providers that would be part of your systems map?
Right, you can again raise your hand, or you could just put some things in the chat.
Okay, TVETs, youth serving NGOs. Employers, yep. What about the health sector? Does the health sector affect youth?
Okay, maybe we'll just sort of use this to go on.
Okay. So from the frontline providers, schools, TVETs, youth serving NGOs, which are the big ministries? So Ministry of Education, Ministry of Health. Are there other ministries at the state level that are important to coordinate across youth work? Youth Labor, Ministry of Labor, yep. Ministry of Youth, good. Okay. So what you would do with your systems map is you would begin to lay out all of these players and then look at the different connections that they have to each other, whether they're direct connections in terms of the flow of policy information and governance, or indirect connections as you get closer and closer to the community level. So, for example, with early childhood in Kenya, it's a very decentralized system. So we had to do this mapping at the central level with all of the different ministries and policies and how they were connected, but then how that information flows down to the regional level, and from the regional level, how the different healthcare facilities were then supporting communities. And so I think it's very similar with the youth work, where you're going to want to connect these ministries and understand, as part of the systems diagnostic, what kind of information they're sharing and what kind of information isn't getting shared that needs to be shared in order to create a more connected youth system in the particular country. So does that make sense to everyone?
Any questions about that you've got? Again, please feel free to just raise your hand and we can open up your line.
Okay, if not, maybe we could.
Audrey,
Yeah.
does this tend to happen when there's an external force, like a Hilton, like an external donor? You know, have you found that this is happening just, you know, by itself in a country, or do you feel that external angle is important to get this kind of work started?
In my experience so far, it's been primarily driven externally, but there is a lot of interest within the countries. I think Tanzania is a great example. Their multi-sectoral coordination body was already in place before Hilton started to come in and request this work. So they were already, you know, looking at how to begin coordinating across the different ministries and organizations. I think doing the systems mapping and getting them engaged in that process helped them understand the linkages better. And that sort of feeds into how they're now working within their working group. But I think in Mozambique, it's a little bit more siloed, and the multi-sectoral coordination body is very, very nascent and hasn't even pulled everybody together yet. So this was an opportunity to get people actually starting to talk to each other. But I think so far we've seen more externally driven than internally driven. I don't know, Laura, from your work, would you agree?
Yeah, unfortunately, I think that seems to be the case, especially because siloed systems, they sometimes are, politically advantageous for some actors. And so trying to break down those silos, because a lot of times you'll find that the multi-sectoral coordinating bodies, they don't really have any funding. They don't have, as much of a mandate. One thing that we've kind of learned through this process is of who owns the multi-sectoral plan really matters in terms of how much power and how much heft it has.
Mm-hmm.
And that's been kind of one of the big lessons I've seen so far.
So there's a question here.
Mm-hmm.
Can you perhaps share an example of important information that may get lost between government ministries?
Yeah, do you want to share an example maybe from Tanzania, Laura? I'm trying to think of one from Mozambique.
I think it's not information so much. It's sort of gaps and responsibilities in the system of there's a very much a implicit political economy angle of like in Mozambique, like one thing we learned is that the government tends to have these 5-year plans, and like every year they're measured against the progress towards like the metric that they said they'd hit 5 years from now. And sort of the very much of what gets measured gets done, but it's sort of every government agency has their own targets. And so it's trying to move some of these things that aren't in the 5-year plan or in somebody else's domain is sort of like that level of sort of, I guess, just juncture, I think, is one of the important sort of gaps and lessons and about incentives and relationships.
Yeah, I think another example, again, coming from Mozambique, is you have a lot of the nutrition and food security work sitting in the agriculture ministry, and you have a lot of the stunting and weight and child development, like brain development sitting in health. And they have completely different funding streams, and they're siloed, so they don't share that information across. So it gets down to the communities, but not in a way where it's a coordinated set of activities that are intended to help that whole child. So the nutrition folks will be doing one thing, and then the health folks, will be doing something else, and where they could be talking up here and thinking about, okay, how can we bring those resources together and deal with this stunting issue in a more cohesive manner? How can each country come together as one?
Is it?
That's the big question. Sort of one lesson from our work that I did want to put out there is a lot of this is some of the greatest progress we've seen is when you have like one really strong advocate, one really strong champion of different issues. One of the success stories that comes from Kenya is that one of the counties, Siaya County, the first lady of that county at the time really became a strong advocate for ECD. And so as a result of her advocacy and her interest, like they brought together this the multi-sectoral coordinating board. Everyone was working together. It's called Smart Start Siaya if you want to take a look at it. And so that tends to be one of the enabling factors that really helps. But there again, it is also vulnerable to, when the county leader, moves on or isn't reelected, some of that progress then can be lost. So sort of a trade-off of having that champion versus, whether the systems can be made sustainable after that champion is no longer in a position of power.
Yeah, having the internal champion is a really important piece. I think also having these multi-sectoral coordination bodies, whether it's, within the government or external to where they're pulling everybody in, but that they have the power to actually make changes. And I think that they're not just there for show. that they're actually engaged in, the policymaking process, and then sharing data. Because I think the other place that we see a lot of breakdowns, at least across these three countries, is just in using data for decision making, and how that not only using the data within, the individual silos, but then being willing to share that data across. And I think when you have a multi-sectoral coordination body that's, trying to kind of break down some of these silos, paired with somebody who's really a champion, some of that data can get shared across. And I think that can make a big difference. And I think that's also what we've seen in Siaya County in Kenya.
Yeah. One of the things we've talked about over time as part of the whole community of practice is, the importance of thinking about who's a part of these kind of groups, and not just the leaders. Laura, you were just giving that example. Because, mayors change, heads of organizations, heads of ministries change, a new government comes in. So it becomes just as important to think strategically about people who are in another political party, or eventually they're going to be coming in. How do you bring in the opposition to at least listen and be a part of this when they start to see the change? So when they come in, it isn't like they say, well, we're just going to have to start something new, but they're willing to continue something because they've been part of it. So sometimes you have to bring in some unnatural allies into these processes, because they are going to eventually be, leaders, or they're part of the legislative process or the executive. And even, people from the financial side, budget people, who need to understand how budgets are going to be needing to change to support a more sort of whole young person approach.
No, that's absolutely right. And I think that has to also, that it's a critical part of what you build into the system. I also think sometimes, and we've seen this a little bit with Tanzania, our local partner is very much embedded and has really strong relationships with the different ECD actors, both in Tanzania and in Kenya. And I think when you have somebody who is also external, but able to build those relationships, that can be helpful, because they can continue to build relationships regardless of the political party. If they're, if they're able to kind of remain neutral as a external, research organization, which is who we've been paired with.
So I know we don't have a lot of time left. I don't know whether there's just one other slide you want to show in relation to the youth piece, and then we're going to wrap up. And again, people have other questions. There's ways to get in touch. So yeah, go ahead.
Well, this would take probably a whole other hour, unfortunately. If we had the idea that maybe we could, if we had a little bit more time, try to ask and answer a big question ourselves. But maybe that's what we can leave you with, is come up with a, if you have time, come up with a big question, come up with some guiding questions, and what would that look like in the best case scenario? What would that look like in the real world? And, see where that leads you.
Yeah, so for the youth system, if you go to the next slide. Keep going. Yeah, keep going. So the first step that you would take to adapting the RISE framework for youth is to take a look at these particular categories and think about which ones would actually apply to the youth sector and how you would describe it for the youth sector. And then from there, it would feed into the next slide, which is an empty framework, where you would put the big question, depending on whether you wanted to look at equity or governance or financials, and then start filling in the boxes. And that's what we did as we started to, we looked at what RISE had done for education. Then we aligned those categories, as Laura talked about earlier, to ECD. And then we literally started to break down. The RISE framework has this structure for each of the big broad areas, and you start to fill in as it's appropriate for the youth sector.
So when we send out there's going to be a link to some of this that you'll be able to get when we send this back out to folks who have been a part of it. It'll go back out to everybody. And you can, go on it yourself. You can, if you need to get back in touch, if you have other questions, you can reach out to Mathematica. But there'll be some of the resources that are there for you to be able to use. And we hope that we may need to do, sort of a follow-up on this at some point where it's really much more of a working session. So if you have ideas or, things that you would think would be helpful in terms of a follow-up to something like this, please let us know, and we might be able to do it, sort of early next year, and maybe even do it like an hour and a half or something. But anyway, just let us know what would be helpful to you all. So let's see, Mike, we want to sort of end up with our other slides. Yes.
All right, so we'll have the coming up events. We have shaping skills for climate change impact through higher education services in Egypt. That's going to be on Thursday, July 27 at 9 Eastern time. And it's going to be hosted by the Higher Education Engagement and Transformation Community of Practice. To know more about these events, you can join us at youthpower.org. And of course, it's always been a pleasure to be with you all. And
yes.
Thank you, Laura and Audrey.
Yes, thank you very much to Laura and Audrey for this. And we will be sending something out to the community of practice to give us some input in August. And then we have a really exciting September event with 2 organizations where young people are really leading systems change in the child welfare and mental health areas. So we hope you'll join us.
Thank you.
Thank you, everybody. Have a wonderful day or evening, wherever you may be.
Thanks, everyone.